Sky News has learned that 160 people have died from contaminated blood since the infected blood inquiry began in July 2017.
Well, a freedom of information request to the 4 national bodies that provide financial support to the victims of the scandal revealed that around 90 people died from infected blood last year.
Joining me now from central London is Sky's health correspondent Paul Kelso. Paul, perhaps not an entire surprise that some people have died. We know that at the inquiry, tributes have been paid to many of them, but quite a large number since the inquiry actually begun.
It is really striking. Yes, nearly 3,000 people have died as a result of the contaminated blood products and infected whole blood that was distributed in the 1970s and 1980s, much of it imported from the United States, where it had been sourced from high-risk groups, including prisoners, drug addicts and the like. And the public inquiry, which began hearing evidence earlier this summer, has heard many of those first-hand accounts. As it resumes today in Leeds, we have been passed these freedom of information requests, which have been gathered by campaigners from the 4 national bodies that provide financial support to victims. So these figures only apply to those who are enrolled in these schemes, and they show 90 people in the last year. That's roughly 1 person every 4 days, and 160 in total. 131 people in England, which is by far the largest group. More than 2,000 people are receiving financial support in England. 25 in Scotland and 2 each in Wales and Northern Ireland. And this is a very real issue for the victims, the infected and the affected, those who are living with the loss of a family member or indeed living with diseases to this day. And it was touched on this morning as the inquiry resumed in Leeds by Sir Brian Langstaff, the chairman, who pointed to the case of one witness who was scheduled to give evidence tomorrow to the inquiry. And Sir Brian said that he, in fact, is not well enough not just to come to the inquiry, but too ill even for the inquiry to go to him. And he said he emphasised the importance of time, which is not our friend. And that is clearly something the victims who have been waiting, some of them 3 decades for this inquiry to start, they're going to have to wait nearly 2 for it to conclude. But the cost of that time to those who won't see it finish is obvious.
Paul, thanks very much.